Dynaspeak Online, Level 3, Unit 12. Listening. Healthcare 1. Good evening. My name's Sarah Wilshire, and I'm your host for Good Living, the radio talk show that has a variety of guests discussing interesting topics. Today we have Dr. Matthew Reid, the author of a new report on Maori health, commissioned by the Canterbury District Health Board. Welcome, Dr. Reid.
It's good to be here.
Now, tell us a little bit about the report. It's a report on Maori health. What's it called?
It's called Hauora Waiaha, and that means Health Canterbury. It's called Hauora Waiaha 1 because it's going to be repeated in the future. It's a health profile for Maori in Canterbury.
So, why was there a need for such a report?
Well, we've had a lot of statistics and data about Maori health in Canterbury over the past few years, but we haven't ever brought it together comprehensively in one report. So now we have taken a comprehensive look at Maori health. In this report, we compare Maori and non-Maori health to see what the differences are.
So, that's obviously important for our region.
Yes, definitely. We've had national statistics on Maori and non-Maori health, but one impediment to taking action locally is that we haven't known exactly what the local situation was.
So when you write a report such as this, what's actually involved? What do you have to do?
Well, we get as much data together as we can. Statistics from different sources, such as from the census, from health statistics, from hospital and death records, from surveys about smoking and drinking, all sorts of things. We get all that information together, and then we manipulate the data, so it's easy to compare Maori and non-Maori. After that, we make graphs and tables to make it interesting to look at.
And obviously it's going to be crucial for people in the health sector to be able to refer back to this report.
Yes, you're right. I finished the main writing of the report last year, at the end of last year. And since then, I've presented the findings to Mana Whenua Kia Waitaha, which is a group representing the Ngāi Tahu tribe in Canterbury, and to the District Health Board. Now we'll be looking at what we can do about the findings that we've identified in the report.
So let's talk about some of the findings. What did you find out?
Well, an overall picture would be that Maori health in Canterbury, on average, is a little bit better than Maori health throughout the country.
So that's good, right?
Well, it's fairly positive, but it still lags behind non-Maori health in general in Canterbury. So for things like cardiovascular disease, heart attacks, angina, that kind of thing, Maori are more likely to be hospitalised and more likely to die from that kind of illness. For ischemic heart disease, the findings showed that the numbers are similar for both Maori and non-Maori, but that Maori are more likely to die. We looked at various things that we do for heart disease, and that's in the report. Also, Maori are less likely to have cancer identified and more likely to die. And that's across all kinds of cancers.
Why is that? Is that a cultural thing, or is it perhaps because Maori don't go to see a health professional as often?
Well, there are a number of possibilities. We do have national research data about what those reasons might be. The profile was more about identifying what the differences are, not really why the differences are there. So that's a difficult question to answer. But that's the sort of thing the board will look at, to find out why the differences are there and what the best solutions are.
And how this can be resolved, I suppose. So this report was commissioned by the Canterbury District Health Board?
Yes, it was commissioned by the Canterbury District Health Board, specifically by Hector Matthews, Executive Director for Modern Pacific Health, and also Dr. Raymond Pink, the Chief Medical Officer, who has the Maori health portfolio.
So, after spending so much time on this report, did you find out anything that was surprising to you, either professionally or personally?
Well, not really surprising, but I think I still found it a bit shocking. I mean, even if the statistics in Canterbury are a bit better than nationally, it's still shocking that there are differences. Some of the differences are really quite big. Diabetes, for example. Maori are much more likely to be hospitalised and die from diabetes than non-Maori.
Really? That is shocking. So, Dr. Reid, we could talk about this a lot more. Some really interesting issues have come up, but then that's what the report is all about, isn't it?
Very true.
So, can you just tell us, what is the email address if our listeners want to find out any more information about the report?
Well, I don't have an email address, but I can give you the website. They can go to the Canterbury District Health Board official website, www.cdhb.gov. All the information is there, Sarah.
Well, thank you, Dr. Reid, for coming into the station to give us these interesting findings about Maori health. This is Sarah Wilshire, your host, and this has been Good Living, the programme that brings you news from around New Zealand. Dynaspeak Online, Unit 10, Level 3, Listening, Healthcare 2.